Hey folks, welcome to the 65 Brief, where we explain Medicare in plain English. Quick note, this video is educational only and not connected with or endorsed by Medicare, CMS, or the US government. So today we are talking about late enrollment penalties, also called LEPs, and specifically we are going to look at two of the biggest ones that I believe people need to understand, the Part B late enrollment penalty and the Part D late enrollment penalty. Now these penalties are important because they're not always one-time fees. In some cases, they can be added to your monthly premium for as long as you have that coverage. And here's why that matters. Some Medicare penalties can follow you for life. This means that if you miss the wrong deadline or assume the wrong type of coverage is protecting you, you may end up paying more every single month. So it's not, just about signing up late. It's about understanding when you're allowed to delay Medicare and when and if delaying could cost you. Now, what is an LEP? LEP stands for Late Enrollment Penalty, and it's an extra amount that can be added to your Medicare premium if you delay enrolling when you were first eligible and did not have any kind of other coverage that allows you to delay without a penalty. So, in plain English, Medicare may say you should have enrolled earlier, and because you didn't, your monthly premium is going to be higher. The late enrollment penalties that we're focusing on today are Part B and Part D. Part B is your medical coverage, Part D is your prescription drug coverage. Both of these penalties are important, but they do not work the same way. Part B is based on full 12-month periods, while Part D is based on uncovered months without drug coverage. Before we talk about the penalty, let's quickly review what Part B is. Medicare Part B is the medical side of Original Medicare, so it helps cover things like your doctor visits, outpatient care, preventative services, medically necessary services and devices. For most people, Part B is one of the main pieces of their Medicare coverage. The Part B late enrollment penalty, again, is based on full 12-month periods. So if you could have had Part B but you didn't sign up and you didn't qualify for a special enrollment period, your Part B premium may go up by 10% for each full 12-month period that you delayed. And this is the part that gets most people's attention. In a lot of cases, you pay that penalty for as long as you have Part B. So let's use an example. If someone delayed their Part B for 2 full 12-month periods, and did not have any kind of coverage that gave them a special enrollment period, their Part B premium would be increased by 20%. That's 10% for each full 12-month period that they delayed. So before someone decides to delay Part B, they really need to know whether they're allowed to delay without a penalty. So can you delay without a penalty? In some cases, yes. This usually applies when you or your spouse are still actively working and you have health insurance based on that current employment. If that applies, a special enrollment period may be available when that employment or that coverage ends. The key phrase here is current employment. Not all coverage works the same way. One of the biggest mistakes that I see people make is assuming that any health insurance allows them to delay Part B. That's just not always true. Coverage like COBRA, retiree coverage, marketplace coverage, those things may not protect you from a Part B late enrollment penalty. So before delaying Part B, verify your specific situation. Everybody's situation is different, so don't just assume that because you have insurance, you're automatically protected. Now let's talk about Part D. Part D is your prescription drug coverage. You may get that through something like a standalone Part D plan, or it may be included in a Medicare Advantage plan that has prescription drug coverage built in. And even if you don't take any prescriptions, or maybe just one or two right now, Part D still matters because going without creditable drug coverage can create a penalty later on down the road. The Part D late enrollment penalty works differently than the Part B. Instead of being based on full 12-month periods, it's based on the number of full uncovered months you went without Part D or other creditable prescription drug coverage. So the longer the gap, the larger the penalty can become, and just like Part B, it's usually not a one-time charge. It can be added to your monthly drug coverage premium. So for example, if someone goes, let's say 14 months without a Part D or any kind of other creditable drug coverage after they were supposed to have it, Medicare then calculates that penalty based on those 14 uncovered months. So with Part D, it's not whether you missed the deadline, it's also how long you went without the right kind of prescription drug coverage, if any. And that's why keeping track of your drug coverage matters, especially if you're delaying Medicare or coming off of your employer coverage. For Part D, one of the most important terms is creditable coverage. You heard me say it a few times earlier. Creditable prescription drug coverage means that the coverage is expected to pay, on average, at least as much as a standard Medicare drug coverage plan. So employer or union drug coverage may be creditable, but you want to confirm that. If you receive a notice from your employer saying that your drug coverage is creditable, hold on to that notice, keep it, tuck it in a file somewhere, because that can be important proof later on down the road. Part D has something that I like to call the 63-day rule. So after your Medicare drug enrollment window, if you go more than 63 days in a row without a Part D or other creditable prescription drug coverage, you may end up with that late enrollment penalty. So that's why you do not want long gaps in your drug coverage. And again, even those of you who don't take any medications or maybe don't take a lot of medications should really understand this rule, because the penalty is based on the coverage, not just, whether or not you take any meds. So here's a simple comparison. The Part B penalties are based on full 12-month periods and can add 10% for each full 12-month period that you delayed. Part D penalties are based on full uncovered months without Part D or creditable drug coverage. So Part B is more, if you want to consider it year-based, Part D is more month-based. But the big picture here is the same. Delaying without the right coverage can increase your monthly costs when it comes to Medicare. The good news is that late enrollment penalties are usually avoidable if you have an understanding of the rules ahead of time. So the big things are: know when your Medicare enrollment window is, verify your current coverage, whether it allows you to delay or not, confirm whether your prescription drug coverage is creditable, and keep any notices of the proof that you receive. Don't just rely on guesses, assumptions, or what happened to John, who retired a year ago. Medicare timing can depend on your specific coverage situation. Now, if you already have a late enrollment penalty, don't just ignore it. Review the notice carefully, look at the dates that Medicare is using, check your coverage history, and make sure that Medicare's information is accurate. Sometimes a penalty may be correct, but if you believe there was a mistake, you may have appeal options. The key is to respond and provide the proof if you have coverage that should have protected you during that time. And the main takeaway here is simple. Before delaying Part B or Part D on your Medicare, verify your specific situation. Part B and Part D penalties are calculated differently, but again, both can add extra cost to your monthly premiums. Make sure you know when you're supposed to enroll, whether your current coverage allows you to wait, and whether your prescription drug coverage is considered creditable. Don't guess, don't assume, verify before you delay anything. Guys, this has been another episode of the 65 Brief. Subscribe for clear, plain English Medicare education without the confusion. Thanks for watching, and we'll see you next week.